I just want to explain to you where the program is located in terms of the university organisation, because it gives you an idea of who our links are within the Faculty of Human Sciences. We are one of several departments and centres in the Faculty of Human Sciences. So we sit alongside, obviously, in the linguistics department, we sit alongside the clinical audiology program. But we're also in the same faculty as the Australian School of Advanced Medicine, various education programs, and the Department of Health Professions, which at the moment is the home of the brand new physiotherapy doctorate program. So we've got some really good links in terms of the profession of speech pathology within our faculty. The Macquarie academic staff, as Mridula explained, Dr. Willenberg is here at the front. We also have several other lecturers, Christine Sheard, Leora Ballon, and we have other lecturers who teach into the program for Macquarie, and also other casual lecturers who come in, experts who come in to teach in the program from outside. So we have a range of various people who teach in the program. We also have a range of clinical education staff. These people are all fully qualified speech pathologists who take our students on clinical pracs in other sites around Sydney, and I'll talk a little bit more about clinical pracs in a minute. So why a master's program? Some of you might be thinking about, why would I be doing an undergraduate degree and then a master's versus doing a 4-year bachelor's degree? Well, the master's program in speech pathology allows people with undergraduate degrees in totally different areas to come into the profession of speech pathology without having to do another undergraduate degree. So the students in the master's program at the moment have backgrounds in sometimes related areas like linguistics or psychology, but sometimes quite unrelated areas like business. Sometimes our applicants come from having gone through a decision to change their careers. So they've, first degree in business and marketing, second degree becomes a Master of Speech and Language Pathology. So a 2-year master's program allows someone to change careers or to focus on a particular area of interest that builds on their undergraduate skills in another area. And that means that the whole profession is enriched by this broader range of professionals coming into the program, because of course no education or work experience is wasted. The students who come into the speech pathology program bring with them that previous experience, their knowledge from another area of study, or their work experience from another field as well. Also, master's degrees in general enhance the status of the profession, and like a lot of professional areas around in Australia and internationally, masters are increasingly the entry-level qualification for allied health professions. Not totally, but it is increasing in that direction. And it also allows an Australian professional speech pathology degree to better align, for example, with speech pathology professional qualifications in North America and in the UK. Qualification as a speech pathologist means that you can, on graduation, you can practice as a speech pathologist in Australia and have the status of being eligible for practicing membership of Speech Pathology Australia. And in doing that, you have to have completed a degree program that is accredited by Speech Pathology Australia, as our program is. It also means that graduates have the benefit of a mutual recognition of qualifications agreement between the Australian Professional Association and other professional associations around the world, specifically the ones on the slide there. It means that graduates from the Macquarie program, and in fact all Australian speech pathology degree programs, can take their qualifications quite easily with them to other countries and work in other places around the world, as they do. It also means that international students can come and study in Australia and complete the master's program and then go back home and work and have their Australian degree recognised, which also happens. We have a regular cohort of international students in the speech pathology program here. There are prerequisite units required for study in the master's program specifically, and they're in the units in linguistics. These are the names of the equivalent units at Macquarie University, but it's not necessary that these prerequisites have to be studied at Macquarie. Equivalent units might have been studied elsewhere. But certainly there's quite a strong background expected in terms of linguistics, phonetics and phonology, speech physiology and language acquisition, and also in a couple of areas of psychology and also basic statistics. So there are broadly three entry pathways into the Macquarie Masters program. For students who've done their undergraduate degree here at Macquarie, they will have completed the Bachelor of Speech and Hearing Science, and in that bachelor's degree have covered all of those prerequisite areas of study. And then completing that with a credit average or above, they're then eligible to apply for the master's program in speech pathology. Other applicants might have come from a different university with a different bachelor's program in their background, but as part of that degree have completed all of the prerequisite areas of study. So that's a second possibility. The third is applicants who might have completed a bachelor's degree, say, in business and marketing, and have not studied any psychology or any linguistics or done any statistics. For those students, if they apply for the Masters and meet the other prerequisites in terms of language and their personal statement requirement, then they would be offered a place in the Graduate Diploma of Speech and Communication. And that's a 2-year grad dip that allows an applicant to complete the prerequisite units and receive a graduate diploma in recognition of their studies. And in the academic requirement is a credit average or above. So applications for the MSLP, the coursework masters programs, the deadline for all of them I think at Macquarie is the end of October. Applications are open now for the MSLP, so it's possible to submit an application at this point, but after the end of October it's quite difficult to get in. There is also a requirement that you might have noticed on the website or at the information that we hand out about a personal statement. And there are 3 criteria that we ask applicants to address in that. And this information again is all on the website. An understanding of speech pathology as it's practiced in Australia. We want to make sure that people who are applying for the speech pathology degree really know what they're getting in for. They actually might have seen that video, for example, and understand what it is that speech pathologists do. We wouldn't want anyone to apply for the program on a misunderstanding that this was just an interesting area to study. There are other ways that you can study in communication disorders, but this degree is specifically leading you to work professionally as a speech pathologist. So an understanding of speech pathology as it's practiced. Relevant personal experience of speech pathology or related fields. And there's no one correct answer to this information either. This is really you telling us about yourself and your background, why you're interested in speech pathology and previous study or work experience that you feel is relevant and will enhance the strength of your application. And the third point is an explanation of any factors that are relevant, and that's a kind of anything else you want to tell us criterion. Again, we're not looking for a specific answer or specific information there. That's an opportunity for you to tell us any additional information that you think we need to know so that we can best assess your application. Decisions for the MSLP, because they're now open, they're made fairly soon after applications are received. So if you apply now, you're likely to get a response within the next few weeks. Now, if you're still in the Bachelor of Speech and Hearing Science in 3rd year, obviously you won't get a direct offer for the MSLP, but if you meet all of the other requirements, you could receive a conditional offer for the MSLP for next year, the condition being that you complete your degree with a credit average or above in your remaining units of study. And because this semester has begun, we will be able to see from your transcript that you are in all the right units, that if you complete your undergraduate degree, you will have completed all the prerequisites. So it's not necessary to wait until the end of October to submit your application. We'd also encourage you on the form to make sure that you give us your contact details for December to February. If you're planning to be away, we might need to get in touch with you, so please let us know where you're going to be. And if you do receive, if and when you receive an offer for the MSLP, please note that you will receive an offer letter that lists some requirements that you have to complete before you start the MSLP. All of that information is there, and it has to do, the main one is a New South Wales health check, and that means you have to apply for a National Police Certificate and sign a student undertaking form. You need to complete some vaccinations, and also do a first aid certificate course. It's possible to do the first aid certificate course during first semester next year, but the other two requirements are prerequisites. You cannot begin the masters without having those completed. That means that you're actually able to go on clinical pracs. Without those requirements fulfilled, we can't place you in a clinical prac, which begin in, I think, week 4 of semester 1. So they have to really be done before you start at uni. I just want to briefly go over the components of the MSLP, so just to understand how it works. There are both academic coursework components, so that's where you come to class, you're on campus, sitting in lectures, engaged in tutorials, and there are also clinical components. So like the audiology degree, this is a clinical degree, there's a clinical practicum requirement as well as a coursework component. All of the units within the MSLP are structured around the competency-based occupational standards for speech pathologists in Australia, or CBOS. All of the Australian speech pathology degree programs assess students to develop the entry-level competencies according to this document. And that means that over the 2 years, you cover the full range of communication and swallowing disorders in both adults and children. You don't get to choose to work in the degree program with just adults or children. You have to cover the full range of competencies. And the courses and the clinical pracs cover the principles and techniques for assessment and intervention. Largely, you learn about them in class and you practice them in clinical pracs. So you have to understand the theory and understand the nature of disorders and treatment, and then you actually have to become competent by the time you finish the degree. So a little bit more about clinical placements and the way our program does follow the university timetable, except in one place, and I'll explain that. So in year 1, semester 1, students are basically on campus in classes roughly 3 days a week. They have also 1 day of clinical placement throughout the whole semester. Now, just in case you're adding those up and going 3 + 1, 4, oh great, I've got a day off every week. No, this is, as the audiology degree is, a very intense degree. When you're in class all day. When you're in prac, you're in prac all day. So the day off each week is so that you can study and you can prepare for clinical prac. This is very much a full-time degree. In semester 2, the semester 1 placements, as you can see, there are observations. So in the first semester, clinical placements are about watching what speech pathologists do when working with children for 5 weeks. So 1 day a week for 5 weeks, and then a second one for the second 5 weeks is observing in an adult placement. Or it might be in the reverse order. You might do an adult observation placement first and then paediatrics. But over that first semester, you get to observe in both adults and paediatrics. In second semester, again, another placement, 1 day per week throughout the semester. And in second semester, this is the first time in a clinical prac where you start to take responsibility for your own client caseload. So you go to that same clinical practice site every day, the same day each week for the same place for 13 weeks in succession. Then at the end of the year, and this is where it's not on the university timetable, but between the end of classes in second semester and the beginning of classes in the following year, you have to do a 5-day per week, so full-time block placement for 4 weeks. Now, for some students, they might fit that in between the end of semester 2 and Christmas. Others will have it start before, sort of go over the Christmas period. Others will do them in January or even in February. But for a 4-week block over that summer, there's another clinical placement. And that's a placement that, in fact, for international students can, in some cases, be completed in their home country. In year 2, the placement process is much the same. 1 day per week for 13 weeks in semester 1. The same throughout semester 2, and then a final block placement at the end of semester 2. And that one is completed by the end of January in the following year. Clinical placements are also arranged for you in the speech pathology program by the Directors of Clinical Education, and they alternate between paediatric placement for one time, it'll be an adult placement the next. So you have sort of roughly the same number of adult and paediatric placements. And a range of possible placements. We have clinical sites where we have clinical educators employed in a variety of places around the Sydney area. But many speech pathology placement, I think all of our students will have at least one clinical placement in the Macquarie University Speech Clinic. And it's the teaching and research clinic of the program, and at the moment it is on Lane Cove Road. So you might recognise that building. It's on the corner of Lane Cove Road and Talavera Road, has the university sign across the top, and we have a clinic on level 2 there. That will only be in that location until basically Christmas this year because, as Mridula explained, probably early January, that clinic will shut and a new clinic will open, the Speech and Hearing Clinic here on campus in the Hearing Hub. But for this year, that's where it is. Again, you have an opportunity to observe in that clinic if you'd like to, and you can have the opportunity to talk to current students who'll be there doing their clinical placements, their clinical educators who are speech pathologists, and talk to them about their careers and why they've become a speech pathologist and why what their interests are and what their own course has been, and also to see the students working with clients. Half-day observation visits are available at the speech clinic, and the person you contact is Jenny Banfield. And you can ring her at the clinic phone number and she'll organise a time for you to come in when there are students and clinical educators there. And as Mridula said, next year it will become the Macquarie University Speech and Hearing Clinic here on campus. We also are involved with Macquarie University Hospital at the moment, working on building up a speech pathology service there, and we expect that during next year we will be placing students in clinical pracs in Macquarie University Hospital. So some pretty pictures of the campus. Doesn't quite look like that at the moment, but eventually it does. Okay, job prospects for MSLP graduates, always an important question. They're very good. Every year our graduates compete for and are successful in getting new graduates, specialised new graduate positions. They get jobs in a range of different places. These are some of the sites where last year's grads have ended up this year. And of course, some of them also go back home if they're international students and meet the qualifications that are required there and work in international positions. There's the contact details for more information about the program, and I just want to highlight for you some information that's on the table outside in the foyer there. This brochure, you're all welcome to take a copy of. It has basic information about both audiology and speech pathology. And there's far more detailed information about the master's program on the yellow form, that's more detail in that one, and the pink one has the information about the grad dip, the graduate diploma program.